Well, welcome back. Over the last couple of months, many have put certain doctor's appointments on hold, unsure if they should go. But ladies, it's National Women's Health Week, so we want to remind you that your health care needs cannot be put on pause.
Memorial Hermann OB/GYN Dr. Carlos Perez-Cosio is here to explain why it's important for women to receive essential health care. Doctor, I know you're very busy these days. Thanks for taking time for us today. And let's just jump right in. Essentially, right now, even though we are in the midst of this global pandemic, your advice is that these scheduled appointments, these milestone treatments, should not be put off.
Correct. This pandemic, we have to adapt to. Well, first of all, thank you for having me on the show. But we don't know how long it's going to be, this coronavirus, season or crisis. So for now, I think, if you have a medical problem and you need to come and see your doctor, you should come. You should not delay treatment just because of this. And at this moment, we have in our offices and in the hospital, Memorial Hermann Woodlands, we are screening every patient. We're screening for, temperature. Everybody's wearing a mask. And we have, everything up to date to make sure we're complying with the regulations and safety for our patients, to make sure they're in a safe environment.
Absolutely. And I think that's the biggest concern when people are ready to schedule something. And if it has to be either a virtual appointment or in some cases where they need an in-person office visit, let's talk about the precautions, because I think people want to know what they can expect face-to-face when they have that doctor visit.
Correct, exactly. So first, when a patient makes an appointment, we ask them if they have any symptoms, or if they have any recent history of traveling, anything like that. We also tell them that before getting into the hospital or into our office, they're going to get screened, they're going to get their temperatures checked, they're going to receive a face mask. Also, in our waiting areas, we're keeping everything clean and we're keeping social distancing. So there's no magazines, and the benches are actually the chairs individually are placed with social distancing, to make sure they're not next to each other. Then, of course, every room is cleaned. Before and after every patient, we are following those rules as well. And when they come, even though we're in this season, maybe it's one of the seasons that I think we have the hospital in the best cleaning and safety precautions, because right now that we are all following all these rules, it's a safe environment, and they should not delay the treatment. So for this situation, I think that it's very important for them to know that.
And Doctor, I've been looking at a list here. I'm sure, Courtney, you have the same list of just the cleaning protocols and the safety protocols, testing protocols you have in place there at your facilities. I think it is remarkable that something like a hysterectomy, these days, you guys are so advanced that with robotic surgery, someone could actually come in and go out within the same day, even having a surgery like a hysterectomy.
Exactly, and I have had a lot of patients that have, bring this up. And first of all, before the surgery, they get screened for coronavirus. So they will know, and we will know beforehand that everything is safe and everything's in good hands. So then, with robotic surgery, they go to the hospital and they can get the hysterectomy with minimally invasive techniques such as the robotics, and they can go home the same day. Like pretty much 80% or 90% of the patients could go home the same day. So by this, they minimize, some patients are concerned because they don't want to be in a hospital, but at the same time, they don't want to delay their treatment because they're having issues like bleeding or pain. And we are now able to do that, and we have adapted to this new situation.
Doctor, what's really interesting is we're talking about hysterectomies or scheduled surgeries or something like that. And Wellwoman's exam, if you are due for that or your appointment is coming up, what is your view on that? We need to keep those appointments, correct?
Correct. We will talk with the patients before, and if they have a Wellwoman exam and everything they don't have any concerns, we tell them that they're free to come or they can wait a couple of months. That will be up to them. But if they have any issues or they have a history of an abnormal pap smear, or they have pain or bleeding, or they sometimes notice a small mass in their breast or something, they should not delay the treatment and they should come to get checked, and we'll take good care of that.
And doctor, we are out of time now, but it sounds like it all boils down to prevention, ensuring that whatever you have going on in your body is taken care of before it gets worse.
Correct, and we're here to do that. You know, we can do this with the help of the hospital, Memorial Home in the Woodlands, and you know, all the nurses and the MAs and staff that works in the healthcare system, and of course with the help of our patients. You know, it's a team effort that we're doing in this crisis.
Very nice. Well, Dr. Carlos Perez-Cosio, thank you so much for your time today, sir. And for more information, you can visit memorialhermann.org/women's, or you can call 346-320-5200.